A recent 2024 study looked at UCLs, or ulnar collateral ligaments of the inner elbow, on microscopic MRI in both asymptomatic and symptomatic baseball players. And they looked at 426 players and 426 elbows. They didn't mention if it was the throwing or dominant arm, but I think it's safe to assume that that's the elbow that they examined. And they hypothesized that they would not find a correlation between amount of UCL injury and presence or absence of symptoms. They did hypothesize that they would see a difference in the symptomatics and the asymptomatics with bone marrow edema. And both of these hypotheses were true. They found that about 30% of the baseball players with symptoms and 30% without had high level injury to the UCL, a grade 3 or grade 4 injury to the ulnar collateral ligament. This ligament is on the inside of the elbow and is commonly classified as the injury in baseball players, especially pitchers, because it takes a lot of stress with throwing. However, as this study illustrates, and what so many studies illustrate, is that when you use sophisticated imaging, and in this instance they used microscopic MRI versus a more traditional MRI, when you use really sophisticated pictures, you will find lots of structural and anatomical flaws. So they found the same amount of flaws in the UCL in those with symptoms and without. And the translation to clinical practice is we want to make sure we get the diagnosis correct. And if your diagnosis is only based or primarily based on what you see on a picture, you may be diagnosing something that's there, but that's not actually the problem. When we diagnose injuries just on a picture, we're more likely to think of reconstructive surgery or surgery for the elbow as a solution. And if we can avoid that and fix the problem without surgery, which obviously includes invasive care, obviously includes more cost and more rehabilitation time afterwards, that would be preferable. When we do a clinical exam, I separate it into 3 parts. A specific verbal question or verbal history where we're asking very specific questions, a physical exam where we're taking all the necessary baselines, such as range of motion, such as strength, power, nerve tension. And then the third part is when we do the clinical testing. And if needed, we can add diagnostic testing outside the clinic, like in a center getting a picture or in a blood lab getting blood work. When we do this, however, I argue that we need to include as clinical testing Robin McKenzie's repeated movement testing, because with that testing, we can really move the neck, we can really move the thoracic spine, we can really move the elbow joint and see if the diagnosis is possibly a mechanical problem that can be fixed with simple movements. A mechanical problem means a joint's not moving well, and moving in a specific direction or two repeatedly will get it back on track. And obviously, that's a very different diagnosis than telling a person, your ligament is not stable, we need to stabilize it with surgery. So going back to my initial part about how they also looked at BME, they also looked at bone marrow edema. They hypothesized that there would be a difference, and they were correct in that hypothesis as well. Those who had symptoms had higher likelihood of having bone marrow edema in their elbows versus those without symptoms. They hypothesized a possible reason is that it's transient inflammation due to throwing, due to the musculature pulling on that area or provoking that area. So there can be lots of things that we find on imaging, such as osteoarthritis, such as labral tears, such as meniscal tears, such as problems with tendons and multiple other structures. And this study focused exclusively on the UCL, or ulnar collateral ligament, and they found that in these throwers, these baseball players, there was the same amount of UCL injury, 30% being a high level of injury in those with and without symptoms. So clinically, we need to translate to we need to do a better job of doing clinical examination so that we're not relying necessarily on pictures, because if we do, we may be diagnosing correctly, we may be diagnosing incorrectly. And if we're diagnosing incorrectly and prescribing a treatment such as surgery that's not needed, that is not the best solution, we are setting ourselves up for not having the best outcomes.